Hello friends, this is DrRBKushwaha, professor in the division of Veterinary Clinical Complex at FVSCNH, Jammu. Welcome to my YouTube channel, and if you are new to my channel, so kindly subscribe the channel and hit the bell icon for further notification. So today I am going to perform a cesarean section in an adult cow. So this cow had the history of difficulty in passing the fetus, that is the dystocia, and the cause of dystocia is incomplete cervix dilatation. So this is the reason why we are going to perform this cesarean section. So cesarean section normally we call C-section. So there are different sides for the cesarean section in the cow and buffalo. So here this one is, you could see here, this is the milk vein, and just below the milk vein here this is the midline. So this is the basically parallel to the midline, that is the paramedian incision, and this is the most common surgical site for the cesarean section. As far as anesthesia is concerned, so I have given the lumbosacral spinal analgesia to desensitize this all caudal area. At the same time, I have also infiltrated the 2% lignocaine solution for the local analgesia, and I have also injected the mixture of the xylazine, butorphanol and ketamine in the ratio of 1:2:3 ratio, and we have given total 3 ml intravenously. So this animal is strained a lot, and this is the reason we have given the lumbosacral spinal analgesia. So for incision, so the length of incision should be 30 cm long. So we start from here. So this is the skin, and this one is the subcutaneous, and immediately after this one, so this is the subcutaneous fascia, and this structure, the cream like structure, this the shining structure, it is the external sheath, or it is the aponeurotic part of the three muscles: external, abdominis, internal and the transverse. And below this one we will find the rectus abdominis. This one is the aponeurotic part. This is the tough structure. And now you could see this rectus abdominis. This rectus abdominis, since here it is a pressure, so that is why it stretches a lot. Now you could see this one is this is the peritoneum. And you could see here the peritoneum is slightly punctured while giving the incision. We pass with this help of scissor, we simply cut this peritoneum. So this is the different structure which you have to encounter during the cesarean section. So this one is the external sheath of the omentum. So this is the rumen. You should not confuse with the uterus. The branching of this blood supply, the way the blood supply, the surgeon must able to differentiate whether this is the rumen or uterus. So this is all intestine here, it is coming. And here we have to separate the omentum also. This one is the external, and here we have to separate because this over the uterus omentum is this one. Give the scissor. So this is the omentum. Scissor. Now you could see this omentum is covered the intestine. Now you could see intestine is coming through this incision. This case is not so easy. I don't think the size of the fetus is 9 months. Yeah, it is the 8 month pregnancy. It is not full term pregnancy because uterus is very small. Otherwise, in normal condition, uterus could have been up to here. So I will try to extrude and in this case we have to give the incision little bit caudally also. Please give the drape. So we have inserted this drape. So we should remember that how many drapes we have inserted. This is very, very important. So now you could see this one is the uterus. So since uterus, this is the cranial part of this uterus. So it means uterus is very, very, you can say, short. Definitely the fetus is not. Now give the blade so that I could increase the incision. So cesarean is become only very easy when the cesarean is of elective type. Otherwise, in case of the dystocia, there is a lot of variation. Elective means where there is no dystocia. Suppose in case of the pelvic fracture, please give the drape. This is the second drape. You pass the drape. So someone please go on that side. यहाँ से इसको pull करो. जाहिद आप जाओ side. Give the one drape also. Give the another drape. इसको 16 gauge की needle से somebody puncture the rumen. So this one is the third drape we are putting inside the cavity. Now you could see, so this is the greater curvature of the uterus. So towards my right side, this one is the ovarian end and this is the all. So still I try to stretch, but because of this size is very less, very small. This much, even this much is sufficient. Give me the blade. So what you do, the moment I give the incision, you try to hold this edge of the uterus so that uterus should not go inside the abdominal cavity. Just ready. Now you could see this is the putrefied. This is infected. This is not a fresh case. Oh my God. Please don't leave this one. Yes. People have, आप लोगों ने हिस्ट्री प्रॉपरली नहीं लिया था. पकड़ा ना. Just catch hold the uterus. Just keep on focusing the holding the uterus. Yes. So this is the very good that even we are able to evacuate the all infected content outside the peritoneal cavity, not inside the peritoneal cavity. You just add the few crystals of cabernet in water and please bring fast. 4 या 6 नॉर्मल वाटर नहीं सिंपल ही डालना टेप वाटर. So now we have removed the fetus. The fetus was dead and macerated a bit. Now you could see we have also administered the 4 bolus of this furia inside this uterus. If you see, so uterus is a little bit relatively it is leathery. It is not as healthy as in case of the normal cesarean section. So in such cases there is a chance of the tearing while suturing. So this on the first layer, so we repair this uterus in the 2 layer. So first layer we repair with the Lambert, then followed by the second layer Cushing. Hold this one. So in the Lambert, you know, this is the bite is taken at right angle of the incision site, including the only up to the submucosa, not the mucosa. Now you could see this is the tear. So this is the reason why I told that because of this leathery nature, the holding power of the uterus has decreased. So here instead of, so we push here and slightly, yes, it is still tearing. So either we have not taken the history properly or owner hidden the something. So we thought before surgery that it would be a full turn, but it is not full turn. So here I am not applying the too much tension, simply just opposing like this. And second layer we will put the so now you could see how the in Lambert pattern you could see the thread. So this is not an elective cesarean, and moreover this is not as per the routine cesarean, because in most of the cases the fetus is full term normal. So this is the something different from the normal. Yes, yes, hold. And whenever we start suturing, we always start suturing from the cervical end, not towards this side. So this is the leathery uterus. Otherwise in normal uterus what happened, by the end here you come, there will be already a involution of this interior part. So, and this is the reason why it is indicated that whenever you start suturing, always start suturing from the cervical end. So now here we will close. Cut it. Now we are going to apply the second layer. Cut it. Let's remove from here. Hold little bit over here. So you just see carefully how this pushing pattern is to be applied. So I am deliberately here taking the bite a little bit wider, just to invert this all Lambert. Don't pull, otherwise it will tear. So this is the technique by which you can. So now you could see the suture pattern of the Lambert one is gone inside. It is not visible, and even the thread of this already taken the 2 or 3 bite for the pushing pattern is also not visible. And this is the reason that why we prefer the first Lambert followed by the pushing. Reverse is not true, means we should never apply the first pushing and then followed by the Lambert, because in the Lambert you could see here there is a visibility of the suture, and once you leave this pattern as a second layer, so what happened, it will come in contact with the peritoneal fluid and the strength of the suture material will decrease. So cesarean section is relatively easier procedure, but it depends on the condition of the patient, condition of the uterus. So in this case, lumbosacral spinal analgesia definitely helped a lot. Otherwise, animal continue to struggle, strain throughout the procedure. Help by putting like this. Don't pull the thread, push the uterus and then pull the thread like this. So this is the problem in case of the infected or long standing macerated case. Slowly and slowly. Again it is stoned. Leave it. So here you could see the bite is parallel to the incision line in the uterus. Again it has turned. we have almost reached to this cranial commissure of the incision. Mop it. Yes, again. Uterus is compromised. It's not healthy. Just pull like this. Try to pull. Now fetus is no. Yes. Try to pull a little bit. Yes. It's okay. Okay. Now last bite is the reverse direction from here. So in this way we repaired this uterus, but still I will prefer to apply the Halsted suture. So Halsted suture is applied where there is a danger of, you can say, dehiscence, or in case of when the uterus is leathery. So it is basically a 2 Lambert pattern. So now Jahid, you just apply the pressure here. You just leave this one. Leave it. So now you could see, so it has gone inside again. So this practice should not be done in the normal cases where the uterus is healthy, but if the uterus is leathery, so you can apply this Halsted suture. And this much is sufficient. Only 2 is sufficient. So you could see we have repaired this uterus in 2 layers, and we further reinforced with this 2 Halsted suture, because since the uterus was leathery. So we have inserted how many?
4.
So this is very important to prevent the leakage of the uterine content, because we never know unless and until you open the uterus. So just to prevent any type of uterine content go inside the peritoneal cavity, we should properly drape this. So this one is the 2. So this is the 3rd one. बस इतना ही था
Yes,
पक्का. So now next step is repair of this paramedian laparotomy incision. So first we repair this one is the, if you see, so this one is the peritoneum, this one is the peritoneum, this one is peritoneum, this is the rectus abdominis muscle, and this one is the aponeurotic part of the three, that is called, this is the external seat of the abdomen. So this and the peritoneum we repair together, all three structure, followed by the then subcuticular hair and then the skin. So you put like this or keep the hand like this. डाल दो whatever the methodology. But the good thing in this operation that by putting this drape all around this uterus, we were able to prevent the contamination into the peritoneal cavity, which is the ultimate aim during the cesarean section, particularly in the infected cases. Dr. Shaharan, you just put the hand like this, ऐसे. इसमें हमने ड्रेप निकाल लिया वैसे,
Yes,
ठीक है. So here this is the number 1 polygalactic 910. So now you could see we have slightly abducted this left hind limb. Now you could see here, so this is the peritoneum and this one is the rectus abdominis. So we have taken the biceps and this is the aponeurotic part. थ्रेड मंगाया हो ना, और
sir. Yes, sir.
हाँ, इसमें थोड़ा ज़्यादा लगेगा. This thread is still, otherwise ideally for this animal this suture material should be a minimum 2 or 3. Don't cut it. So we should practice that. Now you could see I applied, but still the aponeurotic part is far away. So without cutting the second edge, care should be taken, or you surgeon try to put this aponeurotic part together like this. Yes. So this one is the aponeurotic part. So this one is peritoneum. So here I will going to is some sort of cross mattress. Cut it. So suturing of the uterus and the suturing of the closure of the closure of the laparotomy incision is very, very important. So you could see this is the again aponeurotic. So I am taking a single bite just to oppose the aponeurotic part, from the other side. So even peritoneum is left for the few centimeter, it hardly matter. because here the strength is in this aponeurotic, this external seat. So here you could see I am applying the cross mattress pattern. So this is almost closed, so we take another bite in the only the aponeurotic part. Got it. So here you could see we have repaired this laparotomy incision by applying this number 1 polygalactic 19 and cross mattress. Here the rectus abdominis has been repaired, but this aponeurotic part has been left a bit. So just apply the one here, simple interrupted. So in this way we have completed the closure of the laparotomy. So now we are going to repair this second layer. So we also take the bite in the underneath layer, that is the aponeurotic part, just to obliterate the dead space. So like this. We should not hurry in closure of this laparotomy incision in the cesarean section in cattle and buffalo, particularly if the case is not good. Otherwise, what happened? There will be dehiscence of the sutures, and ultimately it leads into the incisional hernia. So here choice over this cross mattress pattern for the repair of this aponeurotic part at the first muscle is just my personal preference. Otherwise you can go with the simple continuous pattern if the suture material is relatively thicker, that is number 2. But I used to prefer this simple interrupted or cross mattress. So here again we take the bite in the aponeurotic part, that is the external sheath. So this subcuticular suture pattern obliterate the dead space further and it bring the edges together. So this is the reason why I used to prefer this subcuticular, whether the small animal or large animal. But I have seen so many surgeons they do not apply this subcuticular and straight way go for the skin suturing. So it is the surgeon choice. This is the closest, so we can it's better to apply here than not actually. So this is the buried suture, so pull like this. Now cut it from here. दबा के काटना. ओह सीजर से दबाओ ना. हाँ काटो. So now you could see in this way. So we applied this subcuticular pattern. So now you could see how the skin edges are close together. So now we go for the horizontal matters, cross matters, simple interrupted. So whatever the suture pattern you like, you just apply it over here. So this is the horizontal matters pattern.